Good afternoon. My name is Erin Colburn. I'm the pre-health advising coordinator for the College of Health Science. It's with great excitement that we have a guest speaker today from Cleveland University of Kansas City. It's Amy Strathman, and she's going to present some information on their chiropractic school located in Kansas City. And I'll let you take it away.
Thanks, Erin. My name is Amy Strathman. Like you said, I am an admissions advisor for the College of Chiropractic at Cleveland University, Kansas City. I am not a chiropractor. However, I have been around chiropractic my whole life. My background is in exercise science. I have my degree from the University of Kansas. I grew up in a chiropractic family. My dad practiced for 38 years. My brother has been practicing for 24 years, and my daughter is now in the program in her second year. So we're pretty excited to have 3 generations of chiropractors in our family. So what we're going to kind of do today is we're just going to kind of talk about what is chiropractic. We're going to talk a little bit about the prerequisites. How do you get into chiropractic school? I want to talk a little bit about Cleveland, and then hopefully if you want some shadowing opportunities, you can get in contact with me, and I'd like to set you up with maybe some chiropractors that are alums of Cleveland and give you that opportunity to get in an office and see if this is a good fit for you. Okay, so let's see, are we moving? Yeah, we're not moving. There we go. So I just need to plug in. All right, so the doctor of the future will give no medicine, but will instruct his patient in the care of the human frame, in diet, and in the cause and prevention of disease. Let's break that down a little bit. When we talk about care of the human frame, that has a lot to do with biomechanics, kinesiology, spinal alignment. We talk about diet, what's in our food sources, the problems that we have with sedentary lifestyles and obesity, and the cause and prevention of disease. This is a quote from Thomas Edison. So this was very forward thinking back in the early 1900s. This aligns with the philosophy of chiropractic that your body is pretty amazing, and if you take care of it, it's going to take care of itself. Okay, still not getting there we go. All right, so we have a huge problem in this country when it comes to healthcare. We tend to focus a lot on symptoms instead of cause. We live in a very fast-paced society where people want instant gratification. They don't have time to be in pain. They don't have time to be sick. Give me a pill. Let's get back to work and school and go about our daily lives. But pain shows up for a reason, and pain is your body's way of saying there's something wrong and you need to listen to that pain. This is a video from Dr. Carl Cleveland III. He is the president of Cleveland University, and talking a little bit about what is chiropractic.
Because you see, for me, chiropractic is really about restoring function. And function to me means the ability for that patient to perform activities of daily living. Function includes increasing the range of motion of that joint, the flexibility, the stability, and optimizing the nervous system's ability to regulate the patient's care.
So a lot of that, I know it's really hard as college students. You don't understand how important functions of daily living are. And as we age, you know, just the things of getting out of bed in the morning and being able to go for a walk and being able to pick up our kids or be active with our kids, or, you know, being able to run a 5K or go skiing or whatever you're interested in, that's what's important to us as we age. And as chiropractors, we're able to give that to your patients, people that just want to get through the day without pain. That's really important. So when we talk about what is chiropractic, you think, oh, that's that back doctor. I don't have migraines. I don't have back pain. Why would I need to see a chiropractor? But chiropractic is a whole body approach to healthcare. Chiropractors work with the nervous system and the musculoskeletal system. So think about your brain and your spinal cord. The brain is the communication command post of your body. The nerves travel down the spinal cord and they branch out and they tell your body what to do. You're not telling your heart to beat, your lungs to breathe, or your stomach to digest. All of that is happening naturally. And so what happens when we have an accident or an injury or just a daily issue of like maybe walking on campus with your heads in your cell phones, or the way you sit on your couch on your laptop to do homework, or your gait analysis, it causes the bones of the spine to start to shift. And when that happens, we now have a hard bone that's pressing on a soft nerve. And so it kind of cuts off that communication supply going to that area of the body. So think about what if that nerve interference was going to your stomach, or maybe your reproductive organs, or a muscle, or your ears, or your heart. So the doctor of chiropractic uses their hands. They do not prescribe drugs, they do not do surgery. They use their hands to put motion through a joint. Your spine is supposed to move. And when it doesn't, that's called a subluxation. It's kind of stuck or fixated. So a doctor of chiropractic is going to find that subluxation, and then with a specific technique and a very specific line of drive, they're going to manually adjust that area to put motion back through the joint so that the nerve supply can be opened up and communicate with the body. Okay, so why would you want to work in chiropractic? As of 2019, we were in 97 VA hospitals and 66 military treatment facilities. If you're wanting to work in sports and athletics, this is an amazing field for you to be in. All of your NFL teams, most of your Major League Baseball teams, NBA, professional hockey, even Division I colleges offer chiropractic to their athletes. 25% of the healthcare staff for the Olympic athletes are chiropractors. Because when you think about it, athletes are very aware of what they're putting into their bodies. So they want a alternative, more natural approach first, instead of going the pharmaceutical and putting chemicals into their body. So if you're thinking sports, I really want you to consider this, okay? This next video is one of our alums from Cleveland, and he happens to be the chiropractor for the Kansas City Royals.
When I first went into practice, I just wanted a practice that kept going. You know, I am Dr. Patrick Hammond, Cleveland grad, 1997. When I first graduated high school, I was first going into education. I wanted to be around people. I also liked the idea of having summers off back then. I injured my back playing basketball when I was 18 years old. Happened to go to a chiropractor, and it gave me significant relief, and I thought this is pretty cool. I think I wanted to look into this as a profession, and that's what drove me down that road. I'm from a small town in North Missouri, so I played sports, but if you're an athlete in a small town, you kind of do all of them. I always enjoyed sports. I just wasn't maybe the greatest athlete. You know, I was good, but never great. So that was one of my drives towards chiropractic, as a way to help people that like that I got helped by a chiropractor. And sports is what initially drove me. My practice initially didn't take that direction. It was mostly just family care. And then I got this probably 25 to 30% sports practice. I started in soccer, I worked with basketball, I got into baseball, so a lot of variety of sports. And with me being a sports fan, it's kind of always been an enjoyment for myself, and that principle of doing chiropractic in that way. I think the biggest challenge I've had throughout the years of practice is keeping it all in balance, right? You have your family life, you have your professional life, you have your spiritual life, you have all these things going on at one time, and trying to keep all of those at a high level at all times is very challenging. What really motivates me and drives me besides my family is just helping people on a daily basis. You know, to get them feeling better, it's like a different person comes out. You know, they're more enjoyable, they're smiling, you can just see it in their eyes as they come in, you know, 3 or 4 or 5 visits. It's a different person, and it's really enjoyable. I think that most people have had a lot of impactful things in their practice over years, and especially over 20 years. I think the most unique and special one to me was probably the World Series. Everybody, the patients were just coming in wanting to know about it, to talk about it, and it was just so much fun and exciting that I wish everybody had that experience. I've met several people that I was starstruck over, from baseball players to rock stars as well. You know, it's very unique. There's a sense of professionalism that has to come through over your being a fan. And so that was always the tricky part for, I think, being from a small town, I think I can get that small town feel through my practice. You know, in a small town, you know everybody, right? You have to treat them very fairly, ethically, morally correct, and not the word's going to spread pretty quickly. But you have to be honest and ethical at all times. You know, you treat people like you want to be treated, and you put them first. And if you do that, your practice will go great.
So he had a lot of great things to say about that. And I just hope that if you're going into any kind of healthcare field, that you will remember to keep it honest, use integrity, ethically and morally correct. Treat your patients the way you'd want to be treated. That's so important when you're going into any kind of healthcare field and dealing with people. When we look at the chiropractic profession, there will be more than 35 million people treated with chiropractic this year. Like I mentioned before, chiropractors do not prescribe drugs. They do not do surgery. If you're looking for a career that is going to allow you flexibility and give you that work-life balance that so many people are looking for, this is definitely something you want to consider. Most of our doctors, they own their own business, much like a dentist or an optometrist. They have the flexibility to set their own hours. The average chiropractor works about 30 to 35 hours a week, and the average salary is $151,000. Now, you're probably not going to make that your first year out of school as you're starting to grow your business and become established in a community. But the sky's the limit where it comes to your earning potential. I know doctors that have single doctor offices. I know doctors that have multiple chiropractors in an office. I know doctors that have multidisciplinary clinics that have physical therapists, maybe a physician's assistant or a nurse practitioner or a massage therapist, a nutritionist in the same office. And that offers the patient a one-stop shop. So somebody in that office is going to be able to get that patient better. So if you ask most of your chiropractors, what do you treat? They're going to tell you cradle to grave, very much like a primary care physician. We are seeing that doctors are wanting to specialize in certain areas within chiropractic. We talk a lot about sports. You can do a certified chiropractic sports physician. You can do a specialty in pediatrics. If you want to work with pregnant moms and babies and kids, you can do that. Animal chiropractic is huge and growing. You have to be a veterinarian or a chiropractor to do your animal chiropractic certification. This is going to be post-grad, usually as continuing education. But where animals are people's livelihood, whether it's ranching, racing, breeding, they want to make sure that those animals are performing optimally, and people spend a lot of money on those animals. As a chiropractor, you're going to have more hours of radiology training than a medical doctor. You're going to know how to take x-rays, you're going to read x-rays, diagnose x-rays. Do you want to include physical therapy into your practice? Do you want to do acupuncture, dry needling, cupping, ultrasound, muscle stem, those kind of things? Do you want to refer your physical therapy out? Do you want to do that in-house? It's completely up to you. You have options, which is really nice. So when we talk a little bit about Cleveland University, Kansas City, there are only 18 chiropractic schools in the country. There is not one in the state of Idaho, so you're going to have to go out of state to do this. What sets Cleveland apart from those other schools is we are a little bit smaller. So we have about 650 students that are in our program. You are not going to be another number. We have a 13-to-1 student to faculty ratio. You're going to know your professors. You're going to know the other students that are in your cohort so that you have a great support group as you're going through grad school. I've been to a lot of large universities where students might have 200, 300, even 400 students in a freshman biology class. That is not going to happen at Cleveland. You will not have more than 105 students in your cohort, and we start 3 cohorts a year. So we are very close-knit and small. And if that's something that's important to you, consider that when looking at graduate schools. As we kind of go through the process of, some of you are like, well, I'm just a freshman. I'm not sure if this is what I want to do. But as freshmen, what you need to do is you need to be exploring healthcare fields. You need to be listening to Zoom sessions. You need to be going to clubs. You need to be taking intro classes. You need to start shadowing to find out what's out there, because lots of times you'll go, oh my gosh, I had no idea that I could do this. Your sophomore year, you're more in tune with your advisors. You're looking at graduation requirements. You're looking at grad school requirements. You're making sure that you're checking all of those boxes. We don't want you to get to your senior year and have somebody say, well, you have to take this class, or nobody told me I had to do this. We want to make sure that you're on track. Your junior year, much like high school, you're starting to look at schools. What area of the country do you think you want to live in? Can you see yourself there? You're starting the application process. You're continuing to shadow, so that by the time your senior year rolls around, that application should be pretty much firmed up. You're going to know your acceptance. You're going to start working on the FAFSA for financial aid. You're going to continue to shadow and make sure that this is what you want. Now, this is just a very generic timeline, and there's lots of things that you can do to set yourself up for success to get into grad school. Most of the programs, you need to be aware of the prerequisites. To become a chiropractor, you need 90 credit hours to start our program with a minimum of a 3.0 GPA. Now, some of you are going 3.0, I can do that. But realize just because you meet the minimum requirements does not guarantee acceptance. The biggest part of our program is the 24 hours of life and physical science. 8 of those hours need to be in chemistry. We recommend Chem 1 and Chem 2. It is not required that you take organic chemistry. We do not have an entrance exam that you have to take for chiropractic school, much like the MCAT or the DAT for dental school or the GRE. So there is no test that you have to take for that. So just keep that in mind, okay? Now, even though I said 3.0 minimum GPA, when we look at our student body at Cleveland, it's typically our student is about a 3.4 to a 3.5 GPA. This chart right here is a graph that shows all of the chiropractic schools and their pass rates on the national boards to become licensed as a doctor of chiropractic. You will take 5 rounds of national boards while you're in the program. The gray line there on the far right of the screen is the average of all of the schools, and it's about an 88%. The gold line next to that is Cleveland. We have the highest pass rate on the national boards of all the chiropractic schools in the country. We are currently sitting at a 96% pass rate, which speaks volumes to our students. It speaks volumes to the caliber of our faculty that are preparing those students for their boards. If you can't pass those boards, you can't get a license, you can't go out and practice, pay back your student loans, those important things. So when you're looking at schools, ask them, how does your school do on national boards? What is your matriculation rate? What is your acceptance rate? All of those things are really important when you start looking at schools. So one more quick video and then we'll wrap it up with some shadowing information.
I always knew I wanted to be in healthcare and helping people. And when I found out that the chiropractic adjustment helps the nervous system function optimally, I knew that's what I wanted my career to be. Day one, when you walk in at Cleveland, you have Dr. Carl Cleveland III as your professor, and you learn how his family is a huge part in chiropractic history. So having that connection, it's meaningful.
The core theme of Cleveland is to be the difference in healthcare. And in the context of the chiropractic program, that's about a drug-free, conservative approach to maintaining proper spinal health. It's truly about making a difference.
One of the most valuable aspects here is our mentorship model. We're able to work with our interns one-on-one. So Abby, for instance, being able to work one-on-one with her, and engage in the overall care of our patients that come into the clinic, that's a huge part of her education and the experience that she receives in Cleveland. Technology is a very big part of our curriculum. We are utilizing what's called our force sensing table, which allows our interns to be able to feel what an adjustment feels like. So that kind of technology is very valuable for us, and it really sets us apart.
It's clear to me that Cleveland is unique in a sense that students get something here they don't get at other colleges. The great confidence and knowledge that we gain to practice chiropractic as we move forward. When you graduate, you're ready to hit the ground running. During my time at Cleveland, if anybody would have told me that I would one day become the chiropractor of the Kansas City Royals or be a part of a World Series or an All-Star game, I would have thought there's no possible way. But the confidence and knowledge and education I got at Cleveland led to that path.
When I enrolled at Cleveland, I knew that I wanted to open my own practice. And throughout my years here at Cleveland, they've helped prepare me in terms of setting up a business plan and educating me not just in the clinical part of it, but also the business aspect. So it's not just about learning the basic sciences, it's about learning how to start a business and become a successful chiropractor.
So I'll have to brag a little bit on Dr. Hansen. My presentation is a couple of years old. So Dr. Abby's already graduated, and she opened up her own practice in Lawrence, Kansas, which is about 30 minutes outside of Kansas City. In 2 years, she has already experienced growing pains. She is in the process of building out new space and growing. She is already hiring an associate doctor. She's a mom of 2 small kids, and she works about 30 hours a week, and that works for her. So she's doing very, very well. And when she talks about preparing you to run a business, that's also built into the curriculum at Cleveland. You're going to have 4 trimesters of business classes. What does a business plan look like? How do you go out and market yourself and know about insurance coding and marketing and everything that's needed to run a business? So when you're also looking at schools, take that into consideration. Are they going to help you with that, or is it just the sciences and then they kind of leave you high and dry? We're not going to do that at Cleveland. What I would love to do is, so many of you that maybe have no idea about chiropractic, or you've never been to a chiropractor, or maybe you've been to a chiropractor as a patient, but you haven't had to spend time with them in an office and gotten to follow them room to room or patient to patient. I would love to connect you with some of our alum. We have alum all over the country. My information is here on the screen. Erin has my information as well. I'm going to leave her one of our CUKC brochures. There is a QR code that you can scan on that if you want to pick that up from her. That QR code will take you right into our website and come directly to me as the admissions advisor. So if that's something you're interested, please reach out to me. I'd love to send you a packet of information. I can send you information on chiropractic. I can send information on the prerequisites, information on coming and visiting and checking out Kansas City. We'd love to have you. I know that coming from this part of the country, it's quite a ways. So of course we will help with travel reimbursement. We will be happy to provide your hotel accommodations while you're in Kansas City. And for those that are traveling, I can help with flight expenses as well. So please don't let that deter you from checking us out. Reach out to me and let's see if we can schedule a time for you to get to Kansas City and see if it's a good fit for you. I'm also going to leave with Erin some of our great spine keychains from Cleveland. So she'll have a few of those in her office as well. So feel free to stop by and pick that up from her. Like I said, if you guys have any questions at all, I would be more than happy to help. Even if you want me to maybe take a look at your transcript, if you're a sophomore or you're a junior and you're like, I wonder if I'm even close, email me a copy of your unofficial transcript. I'll be happy to plug in what you've completed, give you a roadmap, what you still need to take. And that way you can work with your advisors back on campus to make sure that you're checking all of those boxes. Okay. Good luck with the rest of the semester. Stay safe and healthy. And thank you for the opportunity. Good luck.
Great. So just so we can ask a couple of questions that I think students would ask.
Yeah.
Amy, in terms of needing a bachelor's degree to go to chiropractic medicine, it appeared for Cleveland that that's not a requirement, but is that a bonus?
It is not a requirement, but there are certain states that require you to have a bachelor's degree if you're going to practice in that state. And I believe Idaho is one of them. Yeah.
Yep. So in the big scheme of things, while you don't require things like organic chemistry and biochemistry, do those things support students in their education at your chiropractic school, or do you think that those are not necessary?
They're not necessary. We do see that if the student has had some organic background, that's going to set them up for success in our biochemistry classes, because you do have 2 chemistry classes, Biochem 1 and Biochem 2. We have tutoring in place for students, free tutoring, and most of our students are only taking Chem 1 and Chem 2.
Okay. And then in terms of the experiences, what kinds of campus life or activities outside the classroom can students get involved in?
Yeah, absolutely. So, and at Cleveland, with us being a graduate school, we don't have on-campus housing. So you're going to be living in an apartment we're in Overland Park, Kansas, which is a very safe, family-oriented suburb of Kansas City. You have everything that Kansas City has to offer. I say Kansas City is a lot like a big small town. It's not the big congested cities that some schools are located in. So you're looking at cost of living is going to be lower than some other places. You're looking at traffic, you're looking at safety, you're looking at what kind of things can I do for fun. Cleveland gets their students involved. We go to the Royals game. We have Cleveland Day at the Chiefs game. We have Major League Soccer in Kansas City, minor league hockey. So we want our students to have fun outside of the classroom, because this is a very difficult program. Students are typically, our first trimester is 29 credit hours. So much like med school, you're taking all of those basic sciences. It's a full-time job. Yeah.
And just for the students' well-being, how many years is chiropractic school?
Chiropractic school we're on trimesters. So we basically go 15 weeks on and 2 weeks off. So it's 3 years and 4 months.
Okay. And then in terms of clinical exposure and getting that interaction,
Mhm.
how early does that happen in your curriculum?
So we actually start hands-on with palpation in trimester 1. And we have technique simulation labs at Cleveland with force sensing tables that students can actually practice what an adjustment feels like, much like on like a CPR dummy, and they can actually practice what an adjustment feels like. So you're gonna have those 10 trimesters of technique. You'll actually give your first adjustment in try 3, so the end of your first year. And then in try 7 of 10, you will start treating patients in the student clinic. And then your last year, try 8, 9, and 10, you're doing all of your clinicals on campus. We have a clinic on campus, and then we have 2 in the community as well, so you can get out and experience a more diverse patient population. If students get those clinic requirements completed early, they are allowed to leave campus their last semester and actually do what's called a preceptorship, and they can go work in a chiropractic office, maybe go home to work with their chiropractor, or where they know they're going to be getting a job or they want to set up a practice. So that last 4 months is good real world experience for them.
And in terms of maybe the cost of living in your area where you're located, what would you say is maybe the cost of rent for a 1-bedroom?
It's going to vary. You can find something as low as probably $700, and you can probably find something as high as $1,200. So you want the bells and whistles, or you want something, you have options. I have a lot of my students that they tend to start off living alone, and then when they meet people in their class and they find out who has the same study habits or interests, and then they kind of pair up. But if you're wanting to find a roommate, we have a roommate list, we have an apartment guide, so we can help you in our admissions department with that as well.
Okay. Non-traditional to traditional students, maybe students with families, how often do you see that be the case?
Yeah, very diverse. So you're gonna see students that are coming out of a traditional 4-year degree, probably 21, 22 years old, the majority of our students. But we have students that are upwards to 40 or 50 years old that this is their second career and they're doing that. You are going to have people that are married, they have kids, they're career changers. So average age is probably going to be about 22 to 46 to 50. And so you're going to have all of those walks of life within your class.
Do those students feel like they're still able to be successful and accomplish their goals with all of those added factors that play into it?
Absolutely. We have options. Most people are going to jump in and just treat this as a full-time job, but maybe you've been out of school for a little while. You haven't taken a lot of science classes. We recommend that you don't work. Maybe you have to work. And so we have alternate tracks for admission. So if you need to take a reduced load, maybe start off with half the number of credits, but just keep in mind that every time you do that, you're adding 4 more months onto your time in the program. So most people, they're like, I want to get in and get out.
So in that spectrum, you have options for them if they need to work, but you would probably recommend that they not work.
Right. We recommend that they don't work. The financial aid that's available for their scholarships and financial aid allows them to have a living expenses stipend. And so that's what students usually use for rent and gas and, groceries. We have opportunities as far as scholarships goes, admission scholarships. Once our students are actually in the program, they can apply for numerous scholarships for our existing students. It might be anything from $500 to $1,500, but every little bit helps. And that maybe covers the cost of a seminar, a board, or just some fun money. We also have work study on campus. So if students do want to work maybe 10 to 15 hours a week on campus, they can. And most every department on campus has a work study position. So they're very flexible in working around their schedules for them.
If a student was trying to prospect chiropractic schools, what advice could you give them in terms of questions that they should be asking chiropractic schools?
Well, I think the most important, I'm very proud of our school because of our passing board scores. When you talk about philosophy of chiropractic, and you might hear the term straight or mixers. Straight is very focused on the spinal adjustment. Mixers are more, I'm going to bring in all of the physical therapy modalities and the nutritional supplements and maybe even some injectables, depending on where, every part of the country is a little bit different. I think Cleveland kind of aligns a little bit more towards the philosophical side of things. We're still going to give you a good base and introduce you to physical therapy and nutrition and things like that. We just want you to have as many tools in your toolbox so you can practice chiropractic how you want to practice.
Great.
Yeah.
Great. Can you think of any question I may not have asked you that you wish I
Oh,
would
you did
have
so good. That was a lot. No, you're good.
Okay, well, thank you so much. for
Yeah,
your time
thank you
today.
guys. And I'd be happy to answer any questions that you have.
Perfect.